GLP-1 receptor agonists are a relatively new medication used in treatment of type 2 diabetes and for weight management. Examples include dulaglutide, also known with the trade name of Trulicity, semaglutide, also known as Ozempic and Wegovy, and liraglutide, also known as Victoza. The action of these drugs vary and include the increase of insulin secretion, the decrease of glucagon secretion, and the improvement of satiety by targeting the hypothalamus. GLP-1 receptor agonists carry side effects that anesthesiologists need to be aware of. Common adverse events include nausea, vomiting, and diarrhea, typically arise at the start of treatment or following a dose increase. However, a critical concern is their tendency to delay gastric emptying and increase intragastric volume. This phenomenon is partially mediated through the stimulation of central nervous system and vagal pathways. This side effect could increase the risk of pulmonary aspiration of gastric content. These are major concerns, and some case reports have been published on perioperative pulmonary aspiration, but the real impact of this drug on the aspiration is unclear, since large cohort studies are lacking. However, some studies try to understand the incidence of gastric issues in this population. For instance, a retrospective study of patients undergoing gastroscopy revealed that about 24% of patients on semaglutide had increased the residual gastric content. This risk was higher in patients with ongoing gastrointestinal symptoms such as nausea before the gastroscopy. It should be considered that many of these patients stopped semaglutide before the procedure for an average of 7 days. We should also consider that gastric emptying delay is not rare in diabetic patients not taking any GLP-1 agonist drug. Gastric emptying delay is a common diabetes-related complication and is present in around 40% of patients with long-standing type 1 and 2 diabetes. Recent guidelines offer different recommendations on managing these patients in the perioperative period. For example, the American Society of Anaesthesiologists published some recommendations in June 2023. For patients on daily dosing, they suggest holding GLP-1 agonist on the day of the procedure. For patients on weekly dosing, they suggest holding the drug a week prior to the procedure. These guidelines suggest discussing postponed elective procedure in case of active gastrointestinal symptoms, or to consider full stomach precaution or evaluating gastric volume by ultrasound. Sometimes a discussion with the diabetologist is also suggested. On the other hand, the British guidelines do not mandate stopping the medication, but they suggest to evaluate the risk of each patient for delayed gastric emptying. A personalized approach should be considered, tailored to individual patient characteristics and baseline risk. Considerations should include the presence of comorbidities such as diabetes, obesity, or a hiatal hernia, and the presence of gastrointestinal symptoms such as nausea, vomiting, or reflux, as well as ongoing medication and the urgency of the type of procedure. In specific cases, rapid sequence intubation or point-of-care gastric ultrasound should be considered. The creation of institutional protocols should also be considered.